Hello, everyone. Good afternoon. Thank you for joining DataCon LA 2020. I would like to welcome Emily Conant. She will talk about one size doesn't fit all, how data can support tailored approaches in public health. And I am your host, Hestia, and my co-host is Jitesh. Before we start, I'd like to let you guys know all participants are muted to avoid distractions during session. However, if you have any questions, please use the chat app, the WOBA chat app on your mobile or desktop app. Next to the chat is the session Q&A, which will be dedicated section for questions for your speakers. We will be monitoring it and help you ensure that they're all delivered. Please note that the Zoom Q&A won't be monitored as well. So please use the WOVA platform for any chat and session Q&A. The WOVA app also provides you with the ability to create a discussion topic on the community section that will be viewable to all DataCon LA 2020 attendees on the WOVA platform. So without further ado, please, Emily, you can start. Thank you.
Hi, everyone. So unfortunately, my camera is having some problems, so I'm not going to be able to show my face, but I will get started here with the presentation. Okay, can everyone see my presentation?
Yes.
Right. Okay, great. Great. So, all right, so let's begin. So thank you so much, everyone, for coming. My name is Emily Conant, and I'm a data scientist at NextLeaf Analytics. And I'm really excited to be here today to present my talk on one size doesn't fit all, how data can support tailored approaches in public health. So first, I want to get started and talk a little bit about NextLeaf and who we are. So we are a mission-driven nonprofit technology company, and we're based in Los Angeles. Our goal is to preserve human life and protect the planet. We use sensor technologies along with data analytics to provide a more objective picture of what is happening on the ground in order to build better solutions toward difficult global challenges. Our low-cost Bluetooth-enabled sensors are designed to collect data from rural, hard-to-reach areas, and we also have field staff, and they collect this data from the ground, and then they can upload it to our server where it is displayed on a web dashboard, and we can provide customized data analytics. And the human element to our work is really important. Being able to iterate and work with people on the ground to install, service, and constantly improve our technologies is what makes our approach unique. Currently, we are working in vaccines in the vaccine cold chain and clean energy. And today I'll be focusing on a particular problem known as clean cooking. Okay, so nearly half of the Earth's population rely on fires inside of their homes to provide cooking, heating, and light. The incomplete combustion of biomass, such as wood, used to fuel these stoves results in harmful smoke that contains thousands of health-damaging substances. Among them is particulate matter, which is known to be the most dangerous. And black carbon in particular is extremely damaging to both human health and the planet. It is a type of particulate matter that has diameter 2.5 microns, so it's PM 2.5, a type of PM 2.5. And as you can see in this diagram to the right from the World Health Organization, it can get into the deepest regions of the lungs, leading to a variety of health problems in children and adults. And roughly 4 million premature deaths occur each year as a result of indoor air pollution. Some of the diseases it causes are chronic obstructive pulmonary disease, cancer, stroke, heart disease, and nearly half of the premature deaths in children under 5 due to pneumonia are caused by indoor air pollution. It's also really problematic with regards to the climate as well. So black carbon, it's a short-lived climate pollutant, meaning it lasts in the atmosphere for a few days to weeks. Then it comes down to the ground, depending on precipitation, and it can get deposited onto ice and snow, which reduces the surface albedo of the ice and snow, which means so normally they reflect the sunlight, but because black carbon absorbs solar radiation and converts it to heat, it warms these surfaces and causes melting. It's a climate forcing agent, and it's the second largest contributor to global climate change behind CO2. Some sources of black carbon are from cookstoves, diesel engines, industrial coal, and brick kilns, and open burning of agricultural fields. According to the Climate and Clean Air Coalition, household cooking accounts for 58% of black carbon emissions. And additionally, black carbon has a warming impact 460 to 1,500 times stronger than CO2 per unit mass. So it's a significant problem, and that is why we are trying to address it. These are, of course, very concerning, but because black carbon is a short-lived pollutant, it is possible to make a difference. And one way to do that is by replacing these traditional cooking methods with clean cooking. Cooking refers to the process of cooking on a stove that is more efficient, that uses less fuel, and is clean burning. These stoves can be more efficient biomass stoves, liquefied petroleum gas, ethanol, biogas, induction, and solar electric. Those are just a few examples. And there have been a number of initiatives over the last 2 decades that have really tried to introduce clean cooking and make a difference, but they've been largely unsuccessful. And we believe that one of the big reasons for that is a lot of these approaches have focused more on distribution of cook stoves rather than focusing on adoption, making sure that users are actually using them. So this is a little map of our reach for clean cooking. We are currently active in 4 countries. So we are doing some work in Nigeria with our partners, the Rural Women for Energy Security and the Climate and Clean Air Coalition. And currently we've been working on we completed a pilot study where we were exploring 5 different possible solutions to scale up. In Tanzania, we have partnered with the Access to Energy Institute to monitor electric pressure cookers powered by mini solar grids in 30 households. In India, we have a number of initiatives in 5 states, and we're monitoring over 500 households, exploring a variety of solutions focused on biomass, liquefied petroleum gas, and induction. And then in Bangladesh, we have also begun a study monitoring 35 households with biomass and LPG with the Community Partners International. So as I mentioned earlier, we use so we have Bluetooth enabled devices, and we use these to continuously monitor temperature data. We install the devices into homes to monitor both the clean cook stove and traditional cook stove. The device is attached to a metal bar, which conducts the heat well and allows for us to detect when cooking events are taking place. And then our field staff go to the sites to collect the data, upload to our server, and cooking events can be displayed on a web dashboard. So this helps partners see what's going on in real time, and if any problems arise, a field staff member can return to the field and check in on a household. So we are constantly iterating and making sure that we are serving those who need it the most. So we have seen major discrepancies between qualitative and quantitative data. We published an article in Nature Climate Change back in 2016, which demonstrates how data from our Stove Trace platform can help break down barriers to achieving safe, clean, modern energy access for all. So we showed a comparison of cooking duration from self-reported data versus sensor reported data. And as you can see, there are over and under estimates. And many programs have relied heavily on anecdotal data. And as you can see, this can lead to drastically different conclusions, which can furthermore lead to incorrect action, which is why we stand by our data-driven approach. And another thing to keep in mind, not just with like self-reported the cooking times, when asking for feedback, a lot of times people are more likely to say they like something, especially when it's given to them. And so this allows for us to verify whether or not something is actually being used. So just here's an example from our web dashboard, and I've anonymized the households, but this just gives an example. So you can see, you can click on different months and days, and it shows the cook stove make and model, and it each of these squares shows if cooking has happened or not. You can click on the square and look at the temperature time series graph, and then the green means cooking is taking place, blue means no cooking, gray means that there's no data being sent. And if our system detects a data quality issue, we put grid marks on the block. And this helps our team flag down issues like, for example, if a sensor is broken or something, or maybe misplaced, and get it fixed as soon as possible. So the benefit of having this kind of a system is that we are able to take action. This is an example of how the dashboard looked when there was an initial solution implemented. We saw very little cooking events taking place. And these are just like little, just little screenshots. So there were more households involved in this study, but we saw that there wasn't any cooking taking place and the solution wasn't working. So we then proposed a new solution, and then from there we were able to see, oh, this is working better in this context, and that's kind of like the value of how you can take action when you have this data available. And in this next slide, again, like just driving home the fact that point that context really matters. So we have a particular stove model here that was not successful in one country, but highly successful in another. So country B showed not only successful uptake of the clean cooking solution, but they also showed sustained adoption. And we define adoption as using the device each day over, and we look at a rolling mean over a 60-day window. And this is why the contexts matter. There's no correct solution, and what works in one region might not work in another, and vice versa. And so while we're trying to come up with solutions, we follow a stairway to scale model. So we want to make sure we're coming up with the best solutions and in a sustainable way. So the way we go about this is we take a 4-step iterative process to help identify solutions worth scaling and displace traditional cook stoves. And we want to prevent the abandonment and waste of clean cook stoves. Many of the failed studies have resulted in these, they're called equipment graveyards, where many people have just dumped their clean cook stoves, and it's a big problem. So we're trying to prevent that from happening. So first, we like to start by like iterating towards adoption in 10 households. We first begin with a pilot study, select appropriate clean cook stove based on the manufacturer, emissions, costs, select appropriate households for the pilot study based on fuel availability and willingness to experiment with this new device. We then install stove trace track devices on both the clean cook stove and the traditional cook stove and monitor for 3 to 6 months. And this allows us to gauge like whether or not it's a good solution. And if we see the results we want, then we can scale up and move towards step 2. And in that step, we want to see sustained adoption in 100 households. And once again, if we see the sustained adoption, then we move toward the next step. If not, then we have to move back. And we haven't gotten to these next 2 steps yet, but this is what we're moving toward. Is we would like to scale up to 1,000 and then 10,000 households. And then like once we scale up to 1,000 households, we can start doing larger studies like air quality impact studies and look at the benefits of clean cook stoves in terms of emissions, which cannot be seen until the sustained adoption is observed. And We would also like to complete a health study as well, health impact study, once we are able to monitor 10,000 households to verify improvement. So now I just wanted to go over a particular example of one of our pilot studies. This was done in Nigeria, in Abuja, Nigeria, with the Rural Women for Energy Security and Climate and Clean Air Coalition. And the majority of the population in Nigeria uses wood, charcoal, and kerosene for cooking. And there are 64,000 deaths each year attributed to pollution. So for this pilot, we monitored 50 households and we deployed 5 different cooking solutions. So there were 2 different models of improved biomass stoves and 3 different models of clean fuel stoves. And the clean fuel stoves were liquefied petroleum gas, and there were 2 ethanol models. And we so there were 10 households that got each, and then we installed the stove trace Trek devices. We installed 100 of them because we also want to monitor their traditional cook stove. So in this next plot, this shows the average daily cooking on the improved cook stove versus on the improved cook stove biomass models versus the clean fuel stoves. And as you can see here, the average daily cooking minutes for the biomass stoves are higher. And for the clean fuel stoves, you'll notice that up until like mid-July, there isn't much use. And what we found was actually that a lot of people had abandoned them because the fuel was not affordable. So we then introduced a fuel subsidy program, and you can see there's like an increase in use. However, average isn't always the best way to look at this kind of data, especially because it's a small group. So some of the households might contribute more to the average than others. So for that reason, we look at adoption, which I defined earlier as cooking each day over the last 60 days to see if there's like continual usage. And that's kind of more of like a yes, no type thing. Are they doing this or are they not? So if 9 out of 10 households are adopting, then you have 90% adoption. And if you have 6 out of 10, you have 60%. And so what you can see here is that that the biomass stoves do have a higher adoption than the clean fuel stoves, though the usage did drop during the second half of the pilot. And among the clean fuel stoves, LPG performed the best, especially after that fuel subsidy program. It's still not where we'd like it to be, but it was a little better. Something else that was really important that we got from this study was we observed cook stove stacking behavior. So the sensor data shows us that everybody stacks. So I have 2 plots here. This is a plot. So the one on the top is an aggregate of the 10 households that were given biomass A. And this just shows the percentage of households showing adoption. And what you can see here is that actually they're just using both the clean cook stove and the traditional cook stove together. And the plot on the bottom is an individual user that shows that stacking behavior over time. So it's their daily cooking minutes over time. And so we see that everybody stacks and they cook on both their improved and traditional cook stove. So they're not actually displacing the traditional cook stove. But something that that I find surprising about a lot of cook stoves and interventions is just that there's this expectation that when you give you give one solution and you expect displacement to occur, because everybody, even in our kitchens, I mean, we cook on a lot of different things. It's kind of it doesn't really make a whole lot of sense to assume that just because we've given one new solution that they're only going to use that solution, because time and efficiency matter. And so if we're giving another stove, I think it's not so crazy to see people using both of them. And so something we took away from this, and something we're trying to bring attention to, is just the idea of maybe in the future introducing a clean stack in a future intervention, in order to try and discourage this stacking behavior. So after the sensor data was collected over the course of the study, we then conducted a survey among the 50 households, which examined general stove feedback, such as pros and cons, willingness to take out a loan and buy the stove, fuel cost and availability, food preparation preferences, household structure, community influence, and we also measured the pot sizes that they were using on the stoves. And some of the main takeaways from this survey was that usage does not translate to willingness to pay. And so we see that some of the households that were using stoves that had a higher adoption rate did not necessarily would not necessarily be willing to take out a loan to buy the stove. It was interesting to see how the LPG households, 90% of them said they did. And another interesting thing about that is outside of that question, just when asked general pros and cons about the stoves, many people who were given different stoves had mentioned that they would rather have an LPG. So that brings up some interesting questions. We have some ideas about why that might be, but we can't be certain. But that was definitely a very interesting finding. So some other findings from the survey was that fuel cost was a major barrier toward adoption. The lowest adoption ICS models were smaller and unable to accommodate larger pots. So we did the pot size measurements, and a lot of households in Nigeria cook on really large pots. And from measuring the pots in these particular households, we noticed that the households who had these clean fuel stoves that were smaller and less durable also had larger pots, and they had specifically said they didn't like that these stoves could not accommodate their pots. And also we noticed that the ethanol A and B reported less variety in food items being cooked, which isn't surprising just because people weren't really using them to begin with. So I think that all of this feedback is really helpful to better understand the context, how people are cooking, and then that information can be sent to stove manufacturers. And we're hoping that this kind of feedback can help kind of promote more like community focused design. And as I mentioned earlier, I made a comment about how a lot of interventions have focused on distribution. And a point I just want to drive home is that distribution does not equal success. A lot of programs have distributed clean fuel stoves and then claim emission reduction. But actually, if we look at this particular pilot, so if we look at this particular pilot, sure, like we have distributed cleaner stoves, but we have not actually succeeded in reducing emissions. And some of the clean fuel stoves, actually, those households are still polluting more than some of the biomass households. So on this left-hand side, I've broken it down. There's the different stove model, the households with the different stove models, and then there's the total emissions in kilograms. That's their total black carbon emissions, which is calculated from the time series data and the emissions rate. And you can see the breakdown of the traditional cook stove versus the improved cook stove. So the takeaway here is just that, sure, you can give a clean stove, but if it's not being adopted, then you're not going to achieve those emissions reductions. And with that, I just wanted to end with this example of, this is a stove scorecard. This is just anonymous, but after we conduct these studies, we create these stove scorecards where we have information about the stove model and give kind of some background about like the population, the duration of the study, and the benefits and some of the issues that were discovered. And from this, like we like to share this with our partners and with manufacturers. And we're hoping that like this kind of a conversation will create like a good feedback loop to help improve the kinds of solutions that larger organizations are designing, and also encourage manufacturers to take a more community-focused approach, because a lot of these stove manufacturers are creating stoves that are more like camp stoves in a way, and it's just not really conducive to like cooking, especially for large families. So we're hoping that this will really help kind of disrupt the status quo in the cook stove world. So with that, I'd like to wrap up and just thank you for coming. And I guess now we can go to questions. Let's see here.
There are two questions.
Okay.
One is, does flavor of the cooked food playing any role in slow adoption?
Yes, it does. That is something that we have seen in the surveys, that many people have preference toward the way that their food cooks on the traditional cook stove. So I definitely, we've definitely seen that.
Okay. And there's another question, is super interesting things, super interesting that things as basic as pot size or stacking are measured. How did you determine the data points to track?
Sorry, could you repeat that one more time? It broke up a little bit. Oh, wait, I see it now. Okay, so it says basic as pot size or stacking are measured. How do you determine the data points to track?
Mm-hmm.
So I'm not entirely sure if I'm interpreting this right, but the way that we looked at the pot size was we went into the households and measured all of their pots. So we had all of that data, and we also had the measurements, the dimensions of the stoves. And then for the stacking, since we have this sensor, it's temperature time series data that's collecting the cooking events from both the traditional cook stove and the improved cook stove, we are able to plot that data. We can look at it together since we have it all in a time series. Let's see here. I'm not sure. Okay, let me see.
I guess that's it for the questions. Do you guys have any more questions? Please post it on the WOVA app on the event sessions. Very well. Well, I just want to thank you, Emily, for presenting, and I appreciate all the attendees for questions and interactions during the session. Please contact the speaker if you have any further questions regarding this topic. Please provide your comments and feedback to us or the organizers on the community board, or start discussions there to connect with others in the DataCon LA 2020 community. Thank you for joining today's presentation, and I hope you can gain some insights for the session. Have a wonderful day. Thank you so much, Emily. Have a good weekend.
Thank you. You too.
Bye-bye.